The National Institute of Communicable Diseases is warning that the symptoms of malaria can sometimes be mistaken for those of Covid-19. The NICD saying that both infections need to be carefully diagnosed and monitored. Joined now by Dr Jaishree Raman, Principal Medical Scientist at the National Institute for Communicable Diseases. Dr Raman, good evening to you and thank you for your time. Are we seeing a big increase in malaria cases due to this confusion, due also to the season of the year?
So it's really majorly due to the season. You know, we are entering the peak of our malaria season, so we are seeing an increase in cases. But we are seeing what is happening is that we're seeing an increase of misdiagnosis and lots more people having severe malaria. Unfortunately, a slight increase in deaths as well because of this misdiagnosis.
How similar are the symptoms? I mean, Covid-19, we all know every time you want to go into a building, you have to check yourself. Are they the idea of a high temperature, of something going on in your nose and your throat? How similar is that to the beginning symptoms of malaria?
Well, it's exactly the same. It's very frustrating is that both COVID and malaria have the same non-specific early symptoms, which is fever, headache, flu-like symptoms, joint pain, nausea, fatigue. So you really can't tell them apart.
How do you tell them apart then? What do you need to do?
You need to have a test. So a malaria test is, and you can do a rapid test for COVID and malaria. It's really very quick, and that's really the only way you can tell them apart. Obviously, if you leave malaria untreated, you're going to get a lot sicker. That might also be another symptom, but that also happens with COVID. You can get severe COVID. So really, if you start feeling these symptoms and you've been in a malaria area, the best thing is just to go and get a malaria test.
I mean, the thing about malaria is that with cerebral malaria, you can be dead from after a bite within 5 days. So you don't actually have a lot of time.
Exactly. And that's why we raised the alert on Monday when we started seeing a number of deaths and we started investigating that. And it's very clear that it was misdiagnosis and late diagnosis. So we're trying to raise the alarm to ensure that people, even, it's rather have a negative malaria test than ignore it and then get cerebral malaria. As you rightly said, it is very, very often associated with negative outcomes.
I imagine for most people, when they first feel ill, the first thing they're going to do is possibly go to the local clinic. They'll be seen there, I imagine, by a nurse. Are our clinics actually are they equipped to do malaria tests? I mean, most nurses in that position are immediately going to require a COVID test because that's what everyone is suddenly used to.
Exactly, malaria has suffered from having low numbers over the last year or so, really due to restrictions on travel. So people have forgotten about malaria, and we're trying to raise awareness and tell healthcare workers to think about it particularly because we're in our peak season, and if people have travelled to the endemic areas. But all the endemic areas in the healthcare facilities in the public sector should have rapid diagnostic tests, so testing should not be an issue. And in an area like Gauteng, where we know we have increases of cases due to people coming from outside the country into the country to work, there's an increased risk of malaria as well, then clinics in Gauteng also should have rapid diagnostic tests.
So we do think of malaria as being by area. I mean, really in the north of Limpopo, you would expect that would be a malaria area. There may be one or two other places. But are you finding that there are also more cases outside of those malaria areas? I mean, mosquitoes not just moving, but perhaps coming in a taxi or something?
So we do see a few of those cases, which is known as a dizzying or taxi malaria. So we have had quite a few cases, and the NICD has been tracking it, and we have seen a slight increase in the cases over the number of years, and obviously unfortunately they're really often associated with fatalities because no one is considering it because it's outside of the malaria area. So yes, mosquitoes occasionally do hitchhike in bags, in taxis, in cars, so it is something to consider.
There's a lot of research going on in the area in terms of fighting malaria. In some cases, it's about using the right kind of mosquito netting, but it's also about targeting the parasite itself. People, in some cases, are talking about a vaccine.
Yeah, no, absolutely. There was a great announcement last year when the WHO first announced the first vaccine after 30 years of research. But again, it's only for children in high endemic areas, so it's never going to come into South Africa. So that is an advancement. But as you get closer to elimination, you have to target the parasite because trying to find a mosquito is virtually impossible. So the closer you get to elimination, then your target is really parasite-based. So it's really tracking every malaria case, treating them effectively, and making sure that they can't transmit to a mosquito.
Dr. Jaishree Raman, thank you very much indeed for your time. I really do appreciate it. Principal Medical Scientist at the National Institute for Communicable Diseases.